Should you stretch if you're hypermobile, particularly if you have EDS or HSD? Most of the time the answer is no, and I'm going to explain why in this video. When you're hypermobile, your ligaments and your joints are already extra loose, which means the muscles have to pick up the extra slack from those loose tissues and the joints. So what happens is you're going to get the sensation that muscles are tight. They're trying for dear life to hang on to those surrounding joints and keep them stable. So what do? They either spasm or they tighten up. So naturally, it's going to feel like you want to stretch those muscles. But is this really the right thing to do? Most of the time it's not, because this means we're going to further destabilize the joint, a joint that's already trying to stay protected from further damage and instability. There are a few cases where it may be appropriate in small doses, but remember, this is not medical advice. I'm just going to give you some background things to think about that you could discuss with your local physical therapist that you're working with. Stretching has multiple benefits in the general population, particularly for those that are stiff. But like we said, when you're hypermobile and things are already destabilized, we may further destabilize those joints. If there is a time where pain is just overwhelming, sometimes some very light stretching into a small range of motion may be helpful in small doses. Let's talk about a couple examples that we could think about here. Let's say, for instance, your hamstrings on the back of your thigh were feeling tight. You might be inclined to stretch your hamstrings. Now, in small doses, this may be okay, but there are a couple ways and things you want to think about when you go about this. There's two types of movements that we think about when we think about stretching or exercising. There's what's called open chain and closed chain. Open chain is when you're moving a joint freely in space. So you were doing some, like let's say you were doing like a tricep extension, and you might be doing that against resistance or with a cable. Whereas closed chain is when the joints are pushed into a surface. They're not freely hanging in space, like a push-up, right? A push-up, you're still working those kind of joints. Now, why do I bring this up? When we are stretching, we want to think about what's one of the biggest issues with hypermobility, and that's proprioception, or the awareness of where your joints are in space. So in a case like this, we want to make sure, and you've seen this if you watch some of our other videos, that we want to give the body as much feedback as possible, right? Because you've probably found if you've gone to stretch that you can just keep going. You can just keep going and going and going. And that's an indication that stretching probably is not the right thing for you. Instead, strength and proprioception exercises are the better thing for you. However, if you're in a particularly difficult flare and you're still inclined to stretch, I would definitely talk to your PT or a healthcare professional. But let's say you were going to do a hamstring stretch. There are two ways that you could go about that. You could lie on your back. I mean, there are many ways, but there's two ways you could do it. You're lying on your back, and you could use a strap to pull your leg up in the air, right? Now, what did we just talk about? We talked about open chain versus closed chain. In that scenario, that is an open chain movement because it's mostly just flying out in space. Your foot's not planted on the surface. I guess you could argue that, the strap is kind of giving some feedback, but it's not going to give as much feedback as if your leg is planted or you have the majority of your weight in your heel to stretch that hamstring, and your pelvis is planted on a surface. So here's what I would recommend doing instead. If you're seated and we look at a side view, both our hips are on the surface. We want to make sure we're not off on one hip or the other hip. And then when we come forward, we want to make sure that we're not bending from our spine. It has to come from the hips, right? And then, for you might be able to go way further than I can. But when we first feel that initial stretch, for me it's here, for you it might be a lot further. That's when we definitely want to stop. We don't want to go until we get a super deep stretch. And again, that's because we're then further lengthening those tissues. So if you were going to stretch, you would want to do it in very small doses and just up into the point of stretch and then back off. And then you could do small cycles of that until you feel a release of the spasm or the tight tissues. If it continues to resist you while you're stretching, that's a sign that stretching is not the right intervention for you. If you feel worse after stretching, or any intervention for that matter, it's probably not the right fit for you. So these are things that we really want to think about. The hamstrings are just an example. I mean, you could apply that to any muscle or any stretch that you're doing, which a lot of people start to ask, well, what about yoga? What about yoga? I mean, I think that for the right person with the right teacher, it can be an appropriate thing because yoga has a lot of closed chain movements. We are, planted, like if you're in warrior poses or things like that, then yoga has a lot of movements that give you feedback. When we're stretching and we're doing yoga or we're doing anything like that, I know some people are going to disagree with me on this. Like yoga, a lot of studios do not use mirrors. I don't agree with that because I think that it's important that you have visual feedback of what you're doing. So if you are stretching, like for instance, if you're doing that hamstring stretch, or you're doing like a hip flexor stretch where you're kind of in that half lunge position, we want to make sure that we can see what we're doing. Because like if you're extending way beyond the pose, you're particularly at risk for injury, especially being someone who's hypermobile. So we want to make sure that if you do something that has a lot of stretching or mobility kind of work, we've talked about this many times on this channel, we need to restrict the movement to 50 to 75% of your range of motion. If 100% in the elbow is beyond straight for you, then we want to probably work it in this range of motion versus into that full extension, because that's where we're at the most risk for injury. In summary, we really want to be focusing on improving the awareness of where your body is in space and strengthening the tissues around. Naturally, as these muscles and the joints feel more protected, that feeling of tightness often goes away. So that's my take on stretching, and I hope this video has been helpful for you. If you did find it helpful, please be sure to like, subscribe, leave a comment, and share it with someone that you think it would be beneficial for. We'll see you in the next video.